Welcome back to our DAE 163. We are all covered up, very PPE'd out here. So you're going to need these 4 sheets. This one I did at 10 o'clock last night for you, so you have it now. You're going to need your cheat sheet on angulations. This one you kind of know already, but it kind of comes with your angulation sheet. And then you're going to need to know your landmarks of the face. Okay. Let's start with angulation, or the landmarks of the face. And some of these you know right now, tragus of the ear is for people who are getting their tattoos now. So let's put these on Mr. Dexter. So we can't really draw on him, we're going to do it with tape. So we're going to put tape along the ala tragus line. So the tragus is this little tag that we have on our ear. So we're going to put a piece of tape along the ala tragus line. And I'll do it over here, Ivan, so you can see it too. I did this piece of tape too big. That's okay. So we're going to do ala tragus line. Then we're going to put along the border of the mandible. We used to do it in chalk until one day, one student did not remove the chalk and they had a cow because they didn't know what was on Dexter, even though it was just chalk. So now we just use tape. So when you do the marker or a pen, make sure you don't mark the rubber, because these are very expensive and you can't really get them replaced. So we're going to mark the tragus, and we're going to mark the ala of the nose. Okay. So you guys want to come over here. We're going to follow, the canthus of the eye is the inner corner of the eye. The outer corner of the eye, that's the outer canthus. So we're going to follow the line of the inner corner of the eye. So we're going to follow that, and that's going to be a dot. The outer canthus of the eye, that's going to be a dot. And of course we already have the ala of the nose. So you guys want to come over here and look? Because they can kind of see that. You can come over here. I'm going to do it over here. So we've got the ala of the nose, corner of the nose, the inner canthus of the eye, the outer canthus of the eye. Okay. Now we're going to follow it same down. The ala of the nose, the inner canthus of the eye, and the outer canthus of the eye. We're following it the same way down. Okay. The ala of the nose, the inner canthus of the eye. You can come. Okay, I'll probably do the ala of the nose a little too far. Inner canthus of the eye, outer canthus of the eye. So you've got these landmarks that you're going to be pointing your central ray to. Because you're not going to have this nice ring to just point to with the bisecting technique. So we have these dots. And I'm just going to point one right on the tip of the nose just because I have the tape there. If you want, you can even put a piece of tape right in the center of the chin because you're going to need one there too. Just because we have it there.
Cool.
Okay? So these are your landmarks that you're going to point your central ray. So we already have this. I already have it set up. So the first one we're going to do is telling me what x-ray. Could someone tell me which x-ray it's asking for? Is it a periapical or is it a bite wing?
Speak up, guys. I hear somebody saying it.
Periapical.
Periapical.
Yeah, it's a periapical.
Very good. Hair high five.
Don't be quiet. Don't be shy. There's no wrong or right answers. Well, there is a right answer, but we won't count it against you if it's wrong. What tooth? 1, 2, 3. So is that a molar or premolar X-ray? Molar. Okay. Now this snap array, this is a tool we use. There's other instruments out there. This is the most commonly used for bisecting. It is for periapicals only. This is not for bite wings. So if you have something to write with, write this down. Snap array is only for periapicals. Okay.
I would write it down because when they say that, it's for the awesome.
The snap array is only for periapicals. It is not for bite wings. And it has two
Snap
sides.
array. Snap array.
Snap /A/ray.
Snap /A/ray.
Do you want to grab the other one also so they can pass it around?
I put some up there on the.
Yeah, this is one of them. I didn't do the other one.
Did you? Okay.
Snap
Yeah, the PA is only periapical
/A/ray.
only.
It has two different sides. One is for the posterior. Looks like a claw. That's the posterior
Everyone
side.
listening to this part, very important.
And this sliding part is for the anterior. Okay. So for the posterior, it will grab the snap array. And if you see, it has a large biting area, and then it has a small area. The patient bites on the wider area. There's really nothing to bite here. So when you put this together, the area that gets the x-ray, or where it says plexus, is always going to be toward the biting area. And like most things in dentistry, this can be used cross-arch. So right now this is set up for the upper left, and the lower. No, did I say it wrong? Upper right. Lower left. I'm looking at you guys. So upper right, lower left. And if I flip it, put it the other way, it will be set up. Also, when you put it in there, you slide this little arm, this little ring, and that will hold it in place. You'll get to fiddle with this a lot. Then it's set up for the lower right and the upper left. Now the difference with bisecting, it does not have to be parallel to the tooth. So you can put it wherever is comfortable with the patient. The bisecting, because you don't have a ring, it's a little harder for you as a radiographer to take it. You have to use the landmarks, you have to use your cheat sheets to take it. Okay. We'll take a few of them using the system that the book tells you about and that most of us learn how to take it. Then I'll show you the way that, the easier way that I have developed, and I'd like you to try it. Okay? So right now it's set up for the lower. Let's do it for the upper right. So it's asking me for the upper right molar. So now it's set up for the upper right molar. I secured it by sliding that arm. It's pretty secure. You want this toward, you can just kind of gently slide it over. Come on over, open them up. You still want to center it if it's a molar shot, and what tooth do we center it on? If it's a molar x-ray, PA, where do we center it on? second molar. Thank you. So I'm going to put it up against the tooth I want it. You don't put it down at the bottom and have the patient bite into place. You touch the tooth you want it and have them close. Now if I look in there, I cannot see that center at all. I always want the patient to bite and then I ask them to smile. That helps me some. So the outer campus of the eye, if that's going to help me guide to see along the allotragus line, that's why I put the tape. That's going to help me. You want to come over here, Ivy?
Yeah. Thank you.
So I changed my setting for a molar. And it's an upper molar. Adult upper molar. So I'm going to go on this side. So can someone look at your cheat sheet? What angulation do I do for an upper molar? On your angulation sheet. Oh, you guys don't have it. Oh, I'm sorry. I'm the only one that has it. Here. Tell me the angulation.
For molars,
Maxillary molar.
it's going to be positive 20 to positive 30.
Okay, so let's try. Let's do 25 just for the heck of it. Okay, so you set it up, positive 25. Your central ray is the center of the PID of the circle here. Okay. So the very center, I am going to point right at that dot. Okay. So I'm going to get it. I'm not changing the angulation. I'm using pretty much the yoke to move it around. Another